Welcome to the West Oncology Conference in beautiful Memphis, Tennessee.
This is a phenomenal meeting based in a phenomenal place. Memphis, Tennessee, home of Elvis. Not only do you get the opportunity to experience the city, but to couple that with great medical education.
The West Oncology Conference at Graceland is our opportunity every year to gather the best experts from our practice and from around the country to talk about the issues that are important to our doctors, to our APPs, to our administrators.
We all have to really stay up to date on all of these fronts in order to keep our practices on the cutting edge. So that's kind of the value proposition for this conference.
We have a great turnout every year. There's a lot of enthusiasm about this meeting because it's close to home. They can get summaries of the most important new data from medical information, from ASCO and ASH and all the major conferences.
I'm really enjoying the broad spectrum of topics that are being covered. It's refreshing my fund of knowledge and I'm learning new things. I think the presenters are very well organized. I think it's a very well-run operation.
Some of the things that I learned from this conference really had to do with ways we can strategize and make our clinical trials efforts more efficient. I was able to talk with colleagues really about some best practices, and I think not only do we learn from more of a case-based and didactic kind of combination, but we're also able to network and really talk to colleagues that normally we wouldn't have time to have those sidebar conversations.
It's really just the right size. Not too big so that people can't get together and talk, but big enough that we can get great expertise on the stage and interacting with the attendees, so you can really learn a lot at this meeting.
We don't really have a lot of time in our daily practices to actually sit down and have a good discussion, so having a big event that actually works for all of us as a group is really important.
You know, when patients get diagnosed with cancer, it's a life-changing event, and I'd really take that into account because it's probably one of the most important information they ever hear. You have cancer, and now we need to establish a relationship because I strongly believe in a partnership between patients and physicians. You know, we try to encourage patients really to embrace the idea of a team approach, shared decision making, and I think it's very important to have good communication.
Conferences like the West Oncology Conference at Graceland in Memphis are very important for academic clinicians as well as for community clinicians.
It's an opportunity for all of us to come together